The MacArthur Foundation believed that Nigeria, Africa's most populous nation, is undergoing a transition of significance for the whole of Sub-Saharan Africa. The foundation has focused on grantmaking here since 1989, supporting efforts to reduce maternal mortality, improve young people's reproductive health and rights, advance human rights and the rule of law, and strengthen higher education.
We have been a long friend of Nigeria. We have shown our commitment to the people of Nigeria through thick and thin, during military rule, during civilian politics. And I think as a result of our friendship, really, to the people of Nigeria, we have come to be trusted. That is seen as some institution that is non-partisan and that is committed to evidence-based research and work.
Nigeria has the second highest maternal death rate in the world, with 1 in 18 women dying in childbirth, often caused by eclampsia, seizures in a pregnant woman that are not related to a pre-existing brain condition, or postpartum hemorrhaging. MacArthur supports the introduction of a standard package of services to health facilities around the country to prevent postpartum hemorrhage. As a key part of this effort, grantees are distributing inexpensive anti-shock garments that help stabilize women who are bleeding during childbirth and increasing the amount of time they have to reach a health facility for treatment. To prevent and treat eclampsia, the Foundation supports promoting the use of magnesium sulfate, identifying barriers to its availability and use, and developing strategies to overcome those barriers.
The examples around maternal mortality in terms of eclampsia and hemorrhage. These two are the major causes of maternal death in Nigeria. And these are two medical interventions that if we're able to scale them up, it means that we are going to be able to respond to one of the major challenges of the Millennium Development Goals.
2 in 5 girls become mothers before age 20. Nearly half of Nigerians aged 15 to 19 are sexually active, and teens make up more than half the country's HIV infections.
Young people in Nigeria constitute about 60% of the population. So we believe that focusing on this next generation of our leaders will significantly reduce the sexual and reproductive health problems in the country.
MacArthur supported locally based Nigerian groups like the Girls Power Initiative and Action Health Incorporated have been able to implement a new sexuality curriculum in public junior secondary schools in 6 states across the country. It is their hope that the more awareness and knowledge young people have, the increased likelihood that they will make wise choices about their sexual activities.
The ultimate goal of this program is to ensure the rights of women to make their own choices about their reproductive health without anybody coercing them in terms of determining what they should do and what should not be done.
To advance human rights and the rule of law, MacArthur's grant-making in this field focuses on building up leading national and local human rights organizations and improving human rights protections in Nigeria's legal architecture through reform of criminal law and procedure and police reform. Through their efforts, grantees have been able to promote the rights of women by finding ways to incorporate human rights into Islamic family law and practices, protect against extrajudicial killings through the revival of state coroner laws and procedures, and revise and publish the laws of Nigeria to reflect basic democratic norms.
Promotion of human rights, both at national level and regional levels that we are doing, are so critical and so important to the existence and survival of we as human beings. We have to have the right to speak, meet with people, express their own opinion, enjoy life simply because they are human beings.
In 2007, Nigeria passed an important milestone. One elected government passed power to another for the first time in the nation's history. MacArthur's support of higher education in Nigeria is based on the belief that robust universities and intellectual freedom are essential to developing and sustaining healthy, economically vibrant democratic societies. An investment in universities is an investment in the social capital of the country. Through this grant making, universities have been able to access cheaper bandwidth, create development offices so that they have alternative sources of income, and provide staff development opportunities.
I love my work at the foundation. I felt that this is one area that I can come and contribute towards bringing about a more just world, a more peaceful world, a world in which people can live together and aspire to be whatever they want to be by supporting them with little resources, but which will ultimately make a great difference in their own lives.